So this sheet is your pre-op instructions. This is going to tell you your surgery day and time. So your surgery is scheduled for date at RCK Surgical Center. So our surgery center is actually in the back of our practice. We have a quad ASF certified ambulatory surgical center. They are the gold standard in patient safety. We like to give you this brochure so that you can read about what Quad A is. They just rebranded, so if this doesn't look familiar to you, it's because they just rebranded. But they basically keep the operating room on their toes. Lots and lots of surgeons have certified facilities, but if you are board certified, Dr. Kratschmer is a board certified plastic surgeon, so if you are board certified, you can only operate in certified facilities. So there's this one, and then there's another one if you have Medicare, Medicaid. We obviously don't do insurance at all, so we do not have a Medicare, Medicaid certification. We don't have any reason to. So this is the one that we do. So our certified facility is here. It's actually, it's in the back of our office space. The benefit of having your surgery here is that, and not to say anything about the hospital because I love the hospitals, but when you go to a big hospital like that, you may go to the operating floor and they have different rooms going on. And so you'll have an anesthesiologist and he may be supervising a couple of different RNs or CRNAs, certified nurse anesthetists. They may be supervising a couple CRNAs giving anesthesia. Well, when we operate here, we don't take the CRNAs, we take the actual anesthesiologist and bring him one-on-one. So you're not getting him through somebody else, you're getting him. Another thing is because we are not part of the hospital, they won't send us their inexperienced anesthesiologist. So not only do we get an anesthesiologist, but we get one of their, really, really great, very experienced people. So I think that's a benefit. Another thing is you're our only patient. Yeah, we can operate on, more, have them recovering while we're doing this or that. We operate multiple times during the day, but we only see one patient. We only have one patient back there at a time. So when you are on that OR table, they're not distracted doing other things. When you go to recovery, for Quad A, you're supposed to have a certain staff, certain, nurse or whatever back there with you, but we actually do a little bit better than that. Our anesthesiologist stays in PACU to watch over you, and then he's actually the one, or she, is the one that actually discharges you. So we take this and we go just a little bit higher with the safety than we need to. So let me get back to this. So our surgery center you're gonna see it's gonna be the office address because that's where you're coming. You're coming to the regular waiting room where you came for your consultation, and it's at 308 East Edgewood Drive in Friendswood. It's gonna tell you what time to be in the waiting room right here. So you don't need to be 2 hours early. That's another benefit. The hospital makes you come 2 hours early. We will tell you what time you need to come, and that's the time that we just plan on you being here. If you take blood pressure, cardiac medication, something like that, we don't stop at those meds. You can take it with a small sip of water, small, like barely anything, sip of water that morning, and then let the anesthesiologist know when you come in. Again, that's blood pressure or cardiac meds. And if you have a question about that, then you need to call us beforehand and make sure that that's okay or not okay to take it. No jewelry, makeup, valuables, no contact lenses, If you need to wear them, you can drive yourself here, but you won't be able to drive yourself out of here. So if you need to wear your contacts here because you drove yourself, that's fine. Just bring your solution, put them in, because you won't be able to wear them during surgery. Glasses, just keep all that in a small tote bag. Don't come in with just carrying all of your stuff. You've got your purse, you've got your phone, you've got your keys, because it's a little, I just don't want you to lose something. We give you a patient bag. I would just make sure that all of your things fit in the bag, or if it's winter, sometimes people have coats, I would bring a tote bag. Don't bring me luggage to carry around for you that day, but bring a tote bag that, just holds your stuff so that you leave with everything that you brought. I can't tell you how many times people bring a tote bag, but it's so small that they have their stuff and then they're carrying slippers. And then, lo and behold, the bag goes back to PACU. We put your bag on the PACU bed while you're in the surgery. PACU means post-anesthesia. So we put it on the recovery bed, and then you wore your shoes to the operating room. So you took your shoes off, and they're, stuck by the... They're not gonna make it in your bag. Make sure that everything is in your bag together, because that bag is what you're going home with. I don't, different people are bringing you and wheeling you out. I don't know that they're gonna remember to grab the shoes that you left over here on the floor before you went in there. I just wanna make sure that you get all your stuff. Wear something, I'm sorry. Nail polish, nails, none of this. I need at least one nail for the thing to go on. Yes, we can put it on your ear, we can put it on your nose, we can put it on your forehead, but I prefer the monitor that reads it off of this. It's just one other thing to deal with. So if you could just give us one finger with nothing on it, no clear, no anything for our monitor, we would appreciate it. Wear something easy to get in and out of. Do not bring me your Lululemon leggings to put you in after surgery, because it's not gonna happen. You're gonna go home in a gown before that's gonna happen. You're really sleepy when you wake up. When we take you to the PACU, you don't want to be bothered. You are so sleepy, it's bright from the lights, you just do not want to be bothered. So we try to minimize your discomfort as much as possible, even with the, trying to get you dressed. So something easy would be, I call them the grandma gowns. Some people call them dusters. They are like $13 at Walmart, and it's literally just like a grandma gown. It buttons or it zips up. Those are the best, especially if you've got a drain tube, because you could just drop that right in the pocket. If you come in with something complicated, we will look at your clothes, what you plan on wearing home that day, and if it's something complicated, we will send your husband, boyfriend, spouse, significant other to Walmart to go and get you a gown while you're asleep, so that we can send you home in it. Things to think about: if you were going to have a catheter when you go home, obviously we're not going to be trying to put shorts on you, so just think about that. Any kind of nightgown is perfect. Buttons or zips, great. If it's got a big loose neckline, that's fine. That's always the best. That's always the best is a nightgown. Arrange for care of children. We don't have a really big office space. It's pretty small, actually, and it's not baby-proofed. I would suggest maybe having somebody watch your children, small children, while you're in surgery. We do have a waiting room if whoever's waiting for you, wants to use the Wi-Fi, wants to work. I can put them back in the exam room if they're trying to take a work call, and that's fine. Everybody can work that way, but we're very small, and so screaming kids and things like that, crying, I just don't want it to distract from what they're trying to do back there, because if they're thinking somebody's screaming, our instinct is to just, we're always on alert. So it can be distracting. If you can, I would just make arrangement for your kids. Do not take aspirin. Aspirin products 1 week prior to surgery and 1 week after surgery. Those can make you bleed. Also, well, we have a whole list, but those are the big ones. I'm gonna add on here, because this just came out and this form has not been updated yet. But if you take Ozempic, Wegovy, semaglutide, Moderna, any of those weight loss injections that work because they're slowing the gastric emptying response, you have to be off of that a week beforehand. Normally, we stop your meds, we stop you from eating, nothing by mouth after midnight. When you have the meds that delay that gastric emptying, what we're seeing is stopping you at midnight the night before your surgery is not enough. You still may have residual things in your stomach, and that can cause aspiration pneumonia, meaning we put the LMA in your throat, it makes you gag a little bit, some of that food comes up, it goes down your airway, it causes a pneumonia. So we do not want that to happen, but that's what everyone's big concern is with all these weight loss injections, is that it slows, and now we need more time. You were taking a lot longer to process that food than stopping food at midnight the night before. So if you were taking that stuff, you have to be off of it 1 week before. No exceptions, not playing around with it. That's way too dangerous for you. You do not want to do that. So I think I missed that line, period. Nothing to eat, the most obvious one. Nothing to eat or drink after midnight the night before your surgery. So if my surgery is on the 20th, I cannot have anything after midnight on the 19th. Again, except if you take that blood pressure cardiac medication, you can take it with a little bit of water the night before, and that's it. You cannot drive yourself home after surgery, and I'm not releasing you to an Uber or somebody that you don't know. If you have a friend, if you have a cousin, if you have a child that can drive, that's fine. Anybody that you know, but you're not going home with a Lyft driver or taxi, none of that. So we will verify when you come in that morning that you have somebody that is available to take you home, and not just take you home, they need to take you home and they need to stay with you the first 24 hours after surgery. And it's rare, very, very rare for you to have a complication from anesthesia, but if you do, it is going to happen within 24 hours, within that first 24-hour period, usually. So the safest thing is for you to have somebody take you home and stay with you that first 24 hours, just in case something happens. That's because that's about how long it takes for all those drugs to get out of your system. The majority of the anesthesia drugs are mostly gone within 24 hours. So we want somebody to be with you. Again, safety first. So we will ask for the phone number that we can get a hold of you that 24 to 72 hours. So where it says telephone number where we can reach you 24 to 72 hours after your procedure, it's fine if you want to give us your phone number if somebody's going to be answering your phone. But if you are asleep, if you go home and go to sleep, we want to know who we can call, who that person is that's going to be with you, answering your phone or their phone. We want their number just in case. That way we can call and check on you. Okay, so that's it. That's the first sheet, pre-op instructions right here.